Again, I'd like to welcome you all to the Leading Systems Change through Expansion and Infusion. We're going to talk about the early lessons from the 5 Statewide Systems Reform Program awardees. These awardees were awarded in October of 2014, so we're just into 1 year of the kickoff here. So we're going to present some of the early lessons. I do want to mention that this program is supported by the Office of Juvenile Justice and Delinquency Prevention, and none of the remarks or ideas or anything presented in this is the ideas of the the ideas only of the presenters and not that of the Department of Justice. So, however, again, welcome all of you. We have a great registration, a great turnout. We're excited for you to hear these early lessons, and I'm really excited to introduce to you our first speaker. Associate Administrator for the Office of Juvenile Justice and Delinquency Prevention, Juvenile Justice System Improvement Division, which is a new division in OJJDP. Kelly Blue has been an outstanding leader for the field of family drug courts, and she's been a tremendous support, and she's really the visionary of this project. So I'm really happy now to go ahead and introduce to you and welcome to the webinar Ms. Kelly Blue. Kelly?
Thank you, Phil. On behalf of OJJDP and Administrator Listenme, we're very pleased to be invited to participate in this webinar and kind of share the federal perspective on this work. So thank you. What I'm going to do is I'm going to talk a little bit about the context and the vision and purpose for this program, and then get into a little bit about the work that we're doing with training and TA around this initiative. So with over 360 family drug courts nationwide serving approximately 19,000 families, family drug courts are a growing response to the problem of families affected by parental substance abuse and child abuse and neglect. We think that family drug courts are uniquely positioned to integrate preventative services across systems with the flexibility to administer an array of services to ensure family engagement in treatment and recovery supports. What we know is that family drug courts at the individual project level have shown that they're very effective in achieving stronger outcomes than outcomes achieved by child welfare and treatment systems and courts by themselves. Family drug courts that effectively bring together substance abuse, mental health, and other social service agencies to meet the needs of the family as a whole have achieved many wonderful outcomes, and you can see that on the slide. Outcomes achieved have been higher rates of parental participation and completion in substance abuse treatment, shorter lengths of stay in foster care for children, higher rates of family reunification, lower rate of termination of parental rights, less reoccurrence of maltreatment, and significant cost savings per family. This research is very powerful. This research has suggested to us that this is a very good reason to institutionalize the principles and methods of family drug courts and to have them be implemented more broadly across state systems. In fiscal year 2014, OJJDP funded and launched the Family Drug Court Statewide Systems Reform Program. This is a 3-year initiative that's designed to expand the scale of family drug courts and increase cooperation between state-level agencies to serve a greater portion of the total child welfare population, and to help states infuse effective and collaborative local-level practices into systemic statewide initiatives. This initiative is a departure from the way we usually do grants in the federal government. For those of you who are familiar with grants at the federal level, typically funding at the federal level, it focuses more on a specific project or a single intervention, and the approach taken under this program is more a systems approach. We're focusing on broader, sustainable statewide systems change, and we're doing this because, as an agency, OJJDP is pushing out juvenile justice system reform. So in thinking about juvenile justice system reform and what that means for OJJDP and for the field and for how we're going to impact system reform, we had a unique opportunity to leverage the work of family drug courts. Here at OJJDP, we think that the Family Drug Court Statewide System Reform Program is a really good reflection of how you can do statewide reform and what it means to do statewide reform. And you'll learn a little bit more in this webinar about the lessons learned and challenges faced in doing this kind of reform. So a little bit about how this program works. The state's administrative office of the court serves as the lead in the systems change effort and works in conjunction with and coordinates closely with the state's court improvement program. Although the state court agencies are the designated lead, the state child welfare, substance abuse treatment, and other key agencies are considered essential collaborating partners. So when we put this initiative together, there were very specific activities or strategies that applicants had to do in order to get the award. So I'm just going to talk a little bit about that. So applicants had to demonstrate an infrastructure to support statewide system reform, outline a long-term strategy, and develop a detailed implementation plan, articulate how state and local initiatives will complement with their application with their proposed design, formulate plans to sustain change initiatives and develop past award support, identify and support effective communication protocols for information sharing, and demonstrating capacity for program evaluation and performance monitoring. And that was real, the piece on program evaluation and performance monitoring was real key for us at the federal level, because we always need data to show the effectiveness of our program and show that our funding is making a difference. But also having built in the program evaluation and performance monitoring also is a way for the states that are engaging in this work for them to demonstrate to their states, to their leaders and their legislators, you know, the impact of the work that they're doing. 5 states received grant awards under this program, and those 5 states are Alabama Administrative Office of the Court. You can see the map up there that shows the states. New York State Unified Court System, Colorado Judicial Department, Judicial Branch of Iowa, and Supreme Court of Ohio. So we're very, very pleased to have our first 5 states on board, and we're very anxious to hear from them and learn about their challenges. I'm excited to know that already in just a one year time period, all of the states have been able to affect some kind of system change. So it's amazing what can be accomplished in a year. So one of the things that makes this program work really well is we have the luxury and the privilege of having a strong partnership with the National Family Drug Court Training and Technical Assistance Program through the Children and Family Futures. And the beauty of this is that Children and Family Futures, I'm going to refer to them as CFF, if that's okay with everyone, is that they are experts in this area, and they bring to the table many years' experience in providing training and technical assistance. So what's been happening is the first 2 years, CFF has worked with the grantees to help them to develop an implementation plan that has identified strategies that each of the sites will pilot test. In year 3, CFF will work with the 5 states to assess their progress with the pilot sites and then to start to develop that multi-year strategic plan. And that the strategic plan is aimed at reforming how the courts are handling cases involving children and parents in the family court docket who are affected by substance abuse and co-occurring disorders. So I want to talk a little bit in more detail about the 3-year planning and implementation process. The way CFF is working with the 5 states is looking at 5 stages that each of the states will go through as part of this planning implementation process. So the first stage is the state assesses its capacity to carry out family drug court principles in wider state systems by using by using a revised version of the collaborative capacity instrument or a similar instrument that CFF will work with the state to administer. The second phase is the development of a 3-year technical assistance plan for each state, and this is based on the result of the self-assessment. So CFF is working hand in hand with the state to make sure that over the 3 years the state gets the very targeted type of TA that is needed. The third stage is the development of peer networks across the participating states, including online access to the lead staff in each agency. This is a way to make sure that we have peer-to-peer networks in place, ways for the states to connect. The fourth phase is focusing on getting into that 3rd year. And this is assessing the progress of what's happening with the pilot sites and then beginning to develop that multi-year implementation plan. So we're moving into implementation at that stage. The final stage is the development of evaluation and information sharing systems to track client progress and cost savings across the state systems and all of the agencies involved. And OJJDP is requiring that each of the states have reporting systems in place in order to qualify for additional funding in future years. So again, as I said earlier, the focus on data, evaluations, performance measures, all those things. It's somewhat of a unique feature of this program, and OJJDP, we're very pleased that we have CFF as a training and TA provider to help the states gather data, assess the data, conduct evaluation, because we know that that type of work can be very challenging to accomplish at the state level. Okay, so one last comment on the implementation plan, and that is that it's a multi-year implementation plan, and the plan, it will recognize that even with strong investment and commitment by state leaders, that statewide systemic reform is very challenging. And it's a process that requires dedicated staffing and technical expertise. And you will hear later in this webinar further detail about CFF's approach to providing in-depth technical assistance. And I just need to say that this notion of technical assistance is really key for this program, and you've heard me use the term in-depth technical assistance, and this is truly in-depth technical assistance. This is the kind of technical assistance that is very targeted. It's almost, if you will, I will hold your hand if you need me to. And I think that's real important, because a lot of times technical assistance can just be a phone call, an email, and this technical assistance is really hands-on. So I want to talk about some activities that OJJDP has recently done around family drug courts. Just last week, we held a family drug court listening session here in Washington, D.C. And at that meeting, we had the privilege of having state leaders, practitioners, and national experts from family drug courts, child welfare, and substance use treatment agencies. And during this meeting, we had the opportunity to review progress, accomplishments, and talk about what's working well in family drug courts and explore what's new going on and what are some of the ongoing challenges and what are some of the new challenges. During the listening session, we also talked about guidance perhaps needed around some national leadership. The goal here is we really want to advance this work, but we also want to advance it in a way that is strategic and in a way that has strong leadership behind it. I'm happy to let you know that the results of this session are being documented, and we will have some materials to share in the near future so that you can see what was discussed at that meeting and potential next steps. So I think in closing, I just want to say that OJJDP is very excited to be part of the family drug court movement as it enters into this new area of advancing practice and policy. We think it's really important to use this practice and policy to better serve children and families in the child welfare system affected by parental substance use. So we're very privileged to be a part of this. Here at OJJDP, we're learning a lot about what systems reform looks like and what it takes to achieve it, and we're also learning a lot about what that means in the context of family drug courts. This webinar will provide you with a glimpse of early lessons learned and the opportunities of this initiative. The Family Drug Court Statewide Systems Reform Program is part of OJJDP's commitment to support states and communities in their efforts to develop and implement effective and coordinated prevention and intervention programs to improve the outcomes for children and families across our nation. Thank you.
Kelly, thank you so much. And again, thank you for your support of this program. Thanks OJJDP for the support of the Family Drug Court movement. I'm going to now turn it over to a person who has been truly a part of the Family Drug Court movement and a part of systems change for over 20 years. She is a true pioneer and leader in the field and happens to be the Executive Director of Children and Family Futures. I'd like to introduce you now to Dr. Nancy Young. Nancy?
Thank you, Phil, and thank you very much, Kelly, for your comments this morning. This is one of the exciting projects that Children and Family Futures has been fortunate to work with Kelly and her colleagues at OJJDP. And let me just recognize the rest of the CFF staff who've really taken the leadership with this project, as well as really trying to understand how we're learning from the sites, and hopefully it's a mutual learning that is going on, but indeed it's a very exciting time for us. I wanted to start just a bit with some reflections of where we've been as we look at the family drug court, beginning first with the leadership of Judge Farnham and Judge McGee in beginning this idea of the adult drug court. Were there ways that those principles, those activities, what later became the components, could be addressed in the civil proceedings of the dependency court. And in 2002, the beginning of trying to understand what is it that family drug courts do differently than the regular dependency docket. Some leadership clearly from the federal government in understanding that there needed to be some way that these could be granted funds from the federal government to try and understand more the process of the family drug courts, as well as, importantly, what are the outcomes. And it's an exciting time that we now have a decade of those kinds of initiatives that we've been able to document the performance measures and the outcomes from family drug courts. And as that moved through, we clearly saw both from funding from the federal government and initiatives at the local level from various courts around the country, as they began to say there are things that we could be doing better even within this model. In particular, in 2007, the addition of some grants to family drug courts to address the children's services needs and to address the issues of trauma, both for children and for the parents, and to implement evidence-based programs. And then, as Kelly just described, the systems change initiative, that we know that there are some things that are working better within those parameters of the family drug court, and we know that there is a tremendous need in child welfare practice and in the court to get better outcomes, frankly, with this particular population. And as we look forward to the lessons from these system change initiatives to understand how to institutionalize that new way or better way of doing practice, part of what we want to introduce today is what do we mean by some of these terms that we're using in terms of like scale and the scope of family drug courts and infusion that you've already heard about today, and how do we sustain that over time. So it's really my privilege to be able to, if you will, explore this window of opportunity for systems change. We're going to do a little bit of definitions. What do we mean by systems change? What do we mean by expanding the scale? And by that, we're very focused on, if you will, the penetration rate. If family drug courts serve a certain number of families within a particular community or county, what is that percentage relative to the need in that county or community for parents to have some of these strategies, more timely access to substance abuse treatment, recovery management, increased judicial oversight? We'll talk about those in a little bit. And how do you look at the scale of what family drug courts are doing and expand that to have a higher penetration rate into the need? And we think about that in two ways, of expanding the capacity of those drug courts that are existing in communities and in states, and as well as state initiatives to expand the number of family drug courts themselves. And then by infusing these, that's already been mentioned, how do we take the active ingredients or the things that we know family drug courts do in common when we look at what they've actually put in place? What are those common strategies? And recognizing that there are many more parents that could benefit from some of those strategies, even without perhaps the formal designation of a family drug court. And we're grappling, I can't say that any of us have the answers about how do you have that specialized docket and intensive services of the family drug court for those families that are most in need of that level of intervention, and how do you infuse some of these ingredients into the larger population so that more families are getting the interventions that they need because they are, in fact, in need of substance abuse treatment. So these concepts, I've mentioned a little bit. We're going to talk about what the systems change mean to us, how we're thinking about expansion, and how some of the states that we're working with are looking at expansion, and then infusion. And what does that mean, and what are those strategies that folks are trying to infuse into that larger docket, if you will. So when we, at Children and Family Futures and in conversations with OJJDP, think about systems change, this is really what we're talking about, a permanent shift in the way we're doing business that relies on the relationships, so the collaborative practice across systems that's built on relationships and within the community for the other supports that families need and ongoing support after their formal time in treatment and in the dependency courts. How do we do that permanent shift to secure the needed resources that we know may be needed to achieve those better results? And focusing on the better results and outcomes for all children and families with substance use disorders, affected by substance use disorders in the child welfare system. That's what we mean by systems change. a graphic that many of you have seen many times, perhaps. It comes from Sid Gardner's publication now 20 years ago, that he says this is what we mean by changing the system. And collaborative practice goes through stages of development. And that first stage of getting to know you, the information exchange, we've all been in those meetings that sometimes we say this is collaboration, but what we're really doing is just exchanging information about the different agencies' priorities, what's going on with the different agencies, beginning to understand the alphabet soup of our partners, and we, I think, have probably all been in collaboratives that we said just never got beyond information exchange. And those are definitely needed, but we think about that as the developmental stage that's needed in order to say, this is what we can understand needs to happen together. How we have a joint project. Typically that happens with outside funding. Clearly it also can happen within a state or within a county that says, these are some things that we could do to work across systems, to work with the court in better ways that allows us to focus on mutual outcomes so that we can work better together on behalf of families, because we recognize that families are touching several different systems as well as the court as they go through the process of working their case plan in child welfare and participate in substance abuse treatment services. So you notice that that bar between joint projects and changing the rules is a little bit broken sometimes. It can go in different directions sometimes. It's the big step. How do you go from what we know to be a joint project, in this particular case, a family drug court that is working very hard at typically a smaller number of families than what are in need of service in their community. But they have a way in which they've come together and understood what works better and perhaps what are the barriers to being able to move that to a larger penetration rate and into a larger impact into their community. We call that the next phase of really changing the rules. What are the rules that are not working for families? Perhaps it's a residential treatment provider who says there's no contact with family for the first 30 days. Understood, very traditional practice. Some of that thinking, though, doesn't reflect what happens if that's a 6-month-old or an 8-month-old or a 16-month-old who is attached to their parent, and 30 days is an extremely long period in their development. How do we think about the rules of how we're putting practice together, and what are the barriers to really achieving better outcomes? We also recognize that that's a big step because it says we're going to look at the funding in our community and look at the existing way in which we're funding services and see if there's some rules that we need to change in order to redirect funds to more successful programs and redirect funds to hit a larger population of the group that needs this in child welfare. And what OJJDP is, if you will, pushing the envelope on is how do you go that last step of changing the system? How do you go that last step that says, we understand that we're going to pay for results, that we're going to be focused on the performance measures, that we're going to have a laser beam on that and change the rules when we find out that that's not really changing the system on behalf of all the families that need it. So we use that as a graphic to say, where are you in your community? Are you going to meetings in which you're still doing information exchange and you're still getting to know your partners? Or have you embarked on this idea that we could do something different together with our communication strategies, with the way we practice and the protocols for practice about collaboration and how workers are to collaborate? Have you moved into that joint project? And then exciting, we think, of actually having some groups that are actually looking at what are the barriers to being able to sustain this new way of doing practice over time. Because we recognize that many initiatives, not just family drug courts, but in particular in this case, family drug courts often sit on top of an unchanged system. It's, oh, we'll send Mary to the family drug court, but we don't have to do anything any different in our practice. And that happens in the court, that happens in child welfare, that happens in the treatment system, the mental health system. Oh, if they're in this specialized program, we'll do something different, recognizing that there are many more parents who need that kind of intervention. And we pull this out as making sure that everyone is focused on, again, that penetration rate, that how do you take what you've learned in family drug court about what works better and move it into that larger system and keep it from being a marginal reform strategy that doesn't affect the larger population. We think about this need for systems change in three ways. I pointed that out on a prior slide, that we're talking about the relationships that are needed across systems, and it's not just who do you know, but it's actually putting in place the agreements about what those relationships will be in the future when those particular staff members have moved on. It's focused on the resources that are needed to do business differently. Often those are resources that are in the community already, not something that's coming from the outside, but are there ways in which we could move resources? And it's not always just money. Many of the strategies are about how you have substance abuse assessment much more timely in the child welfare case plan. That's usually not new money that's needed. That's usually outstationing staff in a different way. How do you mobilize those resources so that we're really focused on the results? And who is monitoring those results? How have the data systems been put together so that you can look across systems? And by put together, I mean not a huge, we have one integrated system in our county. I know there are many jurisdictions that are moving in that direction. But how do you track families across the child welfare, treatment, and court systems, as well as those ancillary services and the importance of mental health services? So we say that the information flow is that lifeblood, the fuel that's needed for an effective collaboration, because it goes between the building of the relationship, the mobilizing the resources, as well as prioritizing the results. And those communication strategies are needed at the case level, at the mid-management level, as well as at the executive level, so that we know that there is information going to leadership, and that information is not just the clinical information, but it's also framing the decisions about those barriers and about how those barriers need to be resolved. So this idea of these 3 R's, if you will, takes that role of leadership. And I'm going to come back to that in a bit about some of those early lessons of leadership from the SSRP 5 sites. So let's talk a minute about this idea of going scale. We see that a lot in the literature. We see that a lot in publications now. It's some of the current thinking du jour that all of a sudden you start seeing going to scale in many different avenues and communications. We mean, again, in this context of families with substance use disorders in the child welfare system, what % of families who are in need receive effective interventions for their substance use disorder? Pretty narrowly focused, I know. You might say, well, that's not going to be enough in our community. But we want you to really focus on, can you count that? Can you count what the need is in your community? Most jurisdictions, I can tell you, cannot. Many jurisdictions have had to do a case review to even get solid data about what is the need of for substance use services in the child welfare population. We know that that expansion of scale can happen in two ways in terms of serving parents through a family drug court. Increasing the capacity of the existing family drug courts, more than 300 sites around the country that have a family drug court in operation. How do you increase their capacity to ensure that they're getting a great return for the investment and that they're penetrating into that need equation sufficiently to say that there's some findings that they could take into the larger system? And then expanding the number of family drug courts. Again, understanding the monitoring that needs to happen about the scale at both the state and the local level of meeting the needs of all families, and which of that population in the child welfare service system are those that need the additional monitoring and the additional services that are affiliated with the family drug court model. This is new thinking, if you will. It's the idea that there are family drug court models that are very appropriate for families who need intensive supervision. No question. The question is, how do you move into that larger population that's in child welfare services who may not have access to the family drug court but are clearly in need of intervention for substance use disorders and need substance abuse treatment? Those are some challenging ideas right now, and we invite all of you to help us as we're understanding those populations. When we look in any one community or the nation as a whole and just using some fairly rough estimates about the need in the child welfare population and the number of family drug courts and their usual number of intakes per year, we think family drug courts are serving less than 10% of the need. So what do we say? We challenge you, we challenge ourselves. What about the other 90%? Is there anything that can happen with that other 90% that we can say, yes, this is a response that is responsive to the substance use treatment needs of the population? We also question these ideas that, is it justice? Is it reasonable effort? And is it reasonable effectiveness to say that there's a small population who gets the family drug court intervention? And some would propose that's the right percentage. Only 10% need that intensive program. We can say clearly that we don't have the data on that to say that in any one community. Understanding who needs that model and who needs substance abuse treatment intervention, and perhaps some of those other things that go along with family drug court, that's really our challenge. So as we think about that question about who should our family drug court be serving and what happens to the other families is what we're thinking about in terms of that systems change. That's the ability to say we've got this larger view of all the families that need services, and how we get there is that systems change that the SSRP sites are working on, and many of you also in your own communities working on. So when we think about scaling up, what are some of the things that we've seen as strategies for scaling up? And in the materials on the dashboard that you can download is a fairly new document that we try to look at the ingredients of family drug court and strategies that we see operating in communities and suggested performance measures that would allow you to monitor, is this working differently, is this working better for this set of families? So I encourage you to look at that document. If you have feedback, we'd love to have the feedback. As I said, it's a new piece. We're just sort of vetting it at this time, and so take a look at it and give us your feedback on that. If you see some things that we need to add or change or delete, let us know. But some of those opportunities for scaling up is having a method in which all families who come to the attention of child welfare have a screen about their substance use disorder, and a method of getting a substance abuse treatment assessment from a qualified staff member who can make the diagnosis, look at the level of care, and help that family get to that treatment resource. We also recognize that that means that there has to be an efficient communication protocol. And I want to emphasize the word efficient, because we've seen lots of ways in which, oh yes, we get reports from treatment providers, oh yes, we have a way in which we're getting that information. But it's not a very efficient way. And given the numbers that we're talking about in child welfare services and the crunch for everybody's time across the system, we really want to stress is this efficient communication protocol, and is it followed in a way that provides the court and attorneys and child welfare the information that they need to make decisions, and vice versa, is information going back to the treatment agency so that they can use that information in their case planning and in their interactions and in their relationship building with parents. That protocol for how do you do that referral of engagement in treatment, is it a warm handoff or is it a piece of paper that says go to ABC treatment agency? We know that the piece of paper, go to that agency, is not very effective, that doesn't happen in most cases. So what is that protocol for how you use strategies that we know are effective using motivational interviewing? How do you use engagement strategies to really help that family engage and in that change process? We'd ask you to look at your eligibility criteria. If you are at 3 or 5%, and sometimes we see it a lower penetration rate, what is it that's blocking folks from being able to get the referral into family drug court? What's that eligibility criteria, and to revisit that. Expanding that target patient population to the high-need families across the child welfare continuum. I mentioned that already. Some of the very well-established family drug courts started with the out-of-home population, and when the opportunity was there and they had lessons about how that works, they were able to bring in what child welfare refers to as in-home cases. By that, we don't mean that the treatment provider is going to the person's home and doing substance abuse counseling in the home. They may very well be doing that with an outreach worker, with engagement strategies, but we're talking about the in-home population in child welfare, which is the much larger number of families. Yet we know that there are many families in in-home services that have high treatment needs. So how do you get that high-need family across the child welfare continuum? And the importance, I'll mention again, of implementing information system linkages that are able to monitor both that penetration rate, how much of the need are we meeting, and the performance measures of what are the results from that. So let me turn my attention for a minute to what is this idea of infusion. And we're talking about, and I've mentioned already, that these FDC common ingredients, how do you take those approaches that seem to be working better with this population and infuse that into all of the child welfare cases that are affected by substance use disorder? How do we take what works in family drug courts and make those strategies a permanent fixture in practice and in policy in the regular dependency court system? Now, I wish I could say that we had the research that is needed to say, aha, of these 7 common ingredients, if you do a mix of 1, 3, and 5, you will have better outcomes. Nobody's done that research. What we know is that these are the strategies, the common ingredients that family drug courts have been putting in place for now some more than a decade. And from that more than a decade of work, we understand that when these are put together, that the outcomes, as Kelly ran through briefly at the beginning of her presentation, we understand that the child welfare outcomes are better. You may have seen this before and you said, wait a minute, Nancy, Phil, you've been telling us there's 6 common ingredients, and that's true. From the 2002 process evaluation, which was really trying to understand what is in that black box when somebody gets referred to a family drug court. Those are the 6 things that were identified. More recently, as we looked at that intervention, particularly related to parenting and children's needs, the data are overwhelming from multiple sites that when that parenting program and the children's needs are addressed and that there is work actually done on the relationship between the parent and the child, that the outcomes from the family drug court surpass those as services as usual, meaning services as usual in the family drug court. So we're very excited by those data. They come largely from the grant program that SAMHSA put into place called Children Affected by Methamphetamine, which were 12 family drug courts around the country that augmented their parenting and children's services, and we now have those data. So if we say these common ingredients in family drug courts, well, what about that system of identifying families and earlier access to assessment and treatment services and that management of the recovery component of the case? Are there pieces of that that can be put into place for all the families in child welfare? Is there a way that we can determine when we've done that some families are going to need even more judicial oversight and the contingency management strategies of the family drug court? Are there ways that we can increase judicial oversight for all families? I think many people are aware that in Connecticut they're doing that increased oversight without it being in a court setting, but they're instituting regular checkups much more frequently and much earlier on in the case than standard practice in the dependency court, which says after the dispositional hearing, you don't really have to come back for 6 months. Well, when we think about what does that mean in the case of a person with a substance use disorder, it sort of doesn't make much sense that we wait that long. So these common ingredients is what we're talking about in Infusion and how we put some strategies in place that actually allow us to adopt those strategies into the larger system. I won't go through those in detail. You'll have this in your handout. And this is a roll-up, if you will, of those strategies and some of the examples of performance measures that you'll see in that table that was part of the handout for today. And again, it takes those 7 common ingredients and says, how could you possibly put that into play? Because, again, back to this graphic, if we're really changing the system, we need to be looking at what those rules are that have practice operating the way it is now, and how do we go to that idea of both results-based funding and changing practice so that we understand that those things are being implemented. So what would that system reform look like? We would propose that there is a structure in place of key players, oversight committee, agency directors, commissioners that monitor the extent to which the family drug court is meeting the larger child welfare needs, that they're integrating how these family drug court initiatives complement other child welfare initiatives in the community. For example, if you're going to move to work in the in-home population, how does that align with your county or your state's initiative to implement alternative response? Just as one example of larger movements that are going on in states and communities, and how does that family drug court complement that other initiative? We know that reform systems would be demonstrating how their work impacts the outcomes for the court, the child welfare system, and substance abuse and mental health. So we're focused again on the results. And then they would be budgeting how resources will be shared, redirected, and leveraged across the system in order to sustain that practice over time. So the opportunities in state system reform, Kelly mentioned that CFF, or Children and Family Features, has allocated change leaders to these sites. It's a much more intensive level of effort than you typically would receive in technical assistance that allows that change leader to be very involved in the state's planning and making sure that we're bringing to them the information that they need. Kelly also mentioned this sort of broadly. This is where we're at with the states moving towards piloting of reforms with selection of pilot sites in 3 of the 5 states at this point. They have work groups that are up and running and action planning to understand what it is that we want these pilot sites to do. In year 3, we'll be looking at the results from those pilots, looking at the data and evaluation capacity in the state, and as they move into developing a multi-year plan. So some considerations, if you wanted to jump on board and say, we're part of this systems reform about better ways to address substance use disorders, the first thing we would say is what's true at the local level is true at the state level and vice versa. In particular, if you're looking at the way in which you're collecting data, that needs to happen at the local level and it needs to happen at the state level. I mentioned this issue previously about calculating the penetration rate, as well as looking at information systems that can document the results and the cost across systems. How do you know that this particular family coming into, or this individual coming into substance abuse treatment isn't that the parent of a child? And do you know if that child is known to the child welfare system? How do you know when someone comes into the child welfare system that this parent actually needs substance abuse treatment services? And do you know if they actually got substance abuse treatment services? How do you use the existing administrative data set to put that in place over time? How do you have a dashboard about the penetration rate, about the performance measures, that your local policymakers and stakeholders know what you're doing as a way to inform them about what's going on in your community that may be working better? I mentioned this already. Number 2, you need an infrastructure. There has to be the broad buy-in, there has to be representation, and importantly, there has to be investment. Those, if you will, first level of development of a collaborative that stays at the information sharing stage means that they don't have anything in the game. There are agencies that are coming and they're sharing information, but they haven't yet said, we're going to invest in a way of doing things differently. It might be something, and I don't mean to say this is just a simple thing to do, but it might be treatment agencies opening up their assessment hours to child welfare. It might be treatment agencies putting that assessment resource at the court or pairing them with a child welfare investigations unit. How do you put something into this game of saying that we're going to move and create an infrastructure that does practice and policy different? We understand that that structure is important in sustaining these changes over time, and that it's a very important communication between what we refer to as the oversight or the executive committee, the steering committee, and what's going on in the community team and the work groups. So that is horizontal communication that happens at these various levels. This is something that we've used for many years to help communities organize who belongs on which committee, how often do they really need to meet, what's the function, And then how are we going to communicate across horizontally as well as vertically within these different committees? These are the work groups in general that the 5 SSRP states have organized. There are a few others that a particular state said we need to work on this, but they're all focused on how do we solve this data problem of using our administrative data sets more effectively. How do we focus on the sustainability of this initiative? What is the training that's already going on, and how do we do the staff development that's needed for this way of doing collaborative practice? And then an expansion and infusion work group that's taking those principles. Third lesson, you need leaders. And leadership doesn't just happen. And it's leadership at every level. There's leaders that are needed at the case level. But leaders are capable of thinking about the larger system. They have effective relationships in that larger system. Leaders are science-informed and very much data-driven. They see barriers as the goals and targets for change, not as a barrier that says we can't do anything. And they're excited by the opportunity to shape a policy environment, really to move beyond this pilot towards expansion and institutionalization. Those leaders, I've mentioned barriers a couple of times. They see barriers as a target for change. They take the approach of barrier busting as a norm. They know the difference between an excuse and a barrier, and they take the effort to say, peeling back those layers of an onion in those barriers to say, what is it that we can do, and what's the change that's needed to address that barrier? Effective leaders have a system focus. We mentioned this already. They see that external policy context. They know they're not the only game in town. They have the relationships to build alliances with the other initiatives that are operating in substance abuse treatment, in courts, and in child welfare. They have that wider lens view. And again, they demand the data to make the scale. They can sell the results of their collaboration to other leaders because they are outcome focused, and they are collecting data on performance, and they have effective ways of sharing that. With that, I'm going to turn things over to Phil. I think that we have just a scant amount of time left. But Phil, why don't you take things on the next step, if you would.
Yes, thanks very much, Nancy. And I appreciate the comments that you made. And we're really excited about some of the early lessons that we have here with the State System Reform Program. I want to also thank Kelly Blue for her early comments on this talk. Let me just run through a few resources that are available to all of you on the call today or listening back to this webinar. We're excited that we will be publishing a revised version of the Family Drug Court Guidelines. That should be out in the next few months. There'll be a limited amount of hard copy publications, but the publication will be published to our website, and you'll be able to download that in the fall of this year. Also coming out in the fall of this year, and with a broad-scale launch in January of 2016, will be the Family Drug Court online tutorial. This will be a self-paced tutorial in which you can invite your newer Family Drug Court professionals to attend, to take the tutorial, and they'll receive a certificate at the completion of it. We also on our website have many resources. One very popular resource that we like to highlight is our discipline-specific orientation materials. In many places, you have new team members joining your team very often, and you want to be able to provide them with some orientation materials. You can go onto our website, select your discipline, and download a specific set of orientation materials that will help them come to speed with what a family drug court is and what it ought to be. You can supplement these materials with your local resources. Lastly, we'd like to highlight our newly updated online tutorials that are hosted by the National Center on Substance Abuse and Child Welfare. There are 3 tutorials, all brand new, updated material, updated research, one for understanding substance abuse and facilitating recovery for child welfare workers, one directed at treatment professionals, and one directed at legal professionals. Each of these come with the ability to obtain continuing education units and or CLEs. Lastly, I just wanted to highlight our peer learning court program. We have 9 peer learning courts currently located throughout the country, and they're willing to open up their doors, open up their phone lines, and open up their their policy and procedural manuals for you to take a look at and share with them and what they're doing in their programs and how they're having success. We have a blog, and that complements this webinar. If you want more information about this webinar or any other webinars we've had in the past, take a look at our blog. There are many other resources that we attach to the blog that supplement the information in our webinar series. With that, I want to thank all of you for joining us today. If you weren't able to see one of our previous webinars, they're all posted to our website. We now have nearly 40 webinars posted to our website with nearly 80 hours of content. All of those are available for you to play back, download materials, listen to as a team, talk through as a team. And then you can contact us if you have any questions about any of those, and we'd be happy to talk to you and work with you and your individual technical assistance and training needs. So with that, I want to thank, again, everyone for listening to today's webinar. I want to thank the states, the awardees, the State System Reform Program awardees for the work that they're doing in their states by being pioneers, being out there, testing the limits, barrier busting. They're doing some tremendous work at a fast pace. I want to thank Nancy for her talk today, and I also want to thank again Kelly Blue and the Office of Juvenile Justice and Delinquency Prevention for their leadership in the family drug court movement. Thanks again for all the work that you do on behalf of children and families, and this will conclude today's webinar.